well-known oncologist says he often deals with patients who have both diabetes and cancer. He says a healthy lifestyle can help you avoid both.
Channel 5's Frank McCaffrey spoke with him about whether there is a link between the two.
For 22 years, Suresh Ratnam has specialized in dealing with cancer patients in McAllen. He says a lot of work has gone into determining if diabetes predisposes to cancer or vice versa.
I actually immigrated as a...
Dr. Suresh Ratnam says there are a number of cases of diabetics who are eventually diagnosed with cancer.
It's interesting because both diseases have, similar risk factors. For instance, being overweight or being obese does increase your risk of diabetes and definitely does increase your risk of certain cancers as well.
Dr. Ratnam says there are cancers that are not unusual to find in diabetics.
If you look at which cancers are common in diabetics compared to a non-diabetic, if you want to see the difference there, I would put liver cancer is definitely more common, seen more commonly in diabetics. The same goes for pancreas cancer, slight increase in colon and rectal cancer as well. Bladder cancer as well seems to be slightly more prominent in diabetics. In women, breast and uterine cancer tends to be more common in diabetics.
Dr. Ratnam tells us older patients are more likely to have diabetes and cancer as well. He says there's likely some hope for patients with both diseases.
There is a lot of work being done with bariatric surgery, which does tend to put diabetes, the vast majority of diabetes cases, into remission. That has been described. There's a lot of interest in that area. And similarly with cancer, if it's an early stage cancer diagnosis, the hope is definitely that you can cure it.
Dr. Ratnam adds the diagnosis of the two diseases can affect the patient psychologically, even if they know there's hope for a treatment. So he finds counseling for patients in need.
On a case-by-case basis, I think everyone has different coping mechanisms. Some people have good, strong family support or social support mechanisms, and that's fine. But some people will come out and tell you, I feel depressed.
He says he refers depressed patients to be treated with medicines.
Now, Dr. Ratnam says weight watching is a key to staying away from a diagnosis. He adds exercising and a healthy diet is the formula to living a long life. In the Channel 5 News studio, Frank McCaffrey, Channel 5 News at 6.